Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute. In this video, we will discuss about various types of circumcisions which are available, which are commonly being done. So circumcision is a surgery which is done for tight foreskin. If somebody has tight foreskin on the penis, or somebody is having problem in pulling back the foreskin, then we do circumcision surgery. Some religions it is being done for religious cause, but some people, adults, because of infections, recurrent infections, or problems with premature ejaculation, or problems with pain in the penis during intercourse, we do circumcision surgery. So now what happens with circumcision surgery is, we generally cut the foreskin, the tip of the extra skin which is on the foreskin, and then after that it looks like a circumcised penis. So now what happens when you do circumcision surgery is, sometimes it loses its sensitivity. The tip of the penis loses its sensitivity, which is actually useful for people with premature ejaculation. And people with recurrent infections, or immediately after intercourse, some people will get small cuts and tears on the tip of the penis. Even they need circumcision procedure. So now what are the common types of procedures which are available? And the most common myth in many people is circumcision is a very painful surgery, but actually it is not. Only the olden method, the open circumcision method, what we used to do before, was really painful. Now most of the circumcision techniques, recently available techniques, they are mainly painless. The only problem you face with these methods is sensitive glands. Now see, the tip of the penis is highly sensitive. If it is inside for many years, so since it is covered with that foreskin, it's always sensitive. Once you do the surgery, then this tip is exposed. So that gives a kind of weird feeling, or sensitive, too much sensitive feeling. So that is one we have to face for first couple of days. So there is a technique for that. We'll put you on a local anesthetic cream which has to be applied after the surgery to desensitize the tip of the penis. So coming to types of circumcisions, we have laser circumcision, we have cosmetic circumcision, and third one is stapler circumcision, and fourth one, without circumcision, those who want to retain their foreskin, we can do a surgery called prepugioplasty, so where we can actually preserve their foreskin. But this prepugioplasty surgery may not be suitable for people with infections. Only for people with tight foreskin, prepugioplasty will help. So now what happens in these surgeries is, one, in stapler circumcision, which is latest nowadays, it's a 5 minutes, we call it as 5-minute circumcision. We just use a device called stapler, and it's like our regular stapler what you use for stapling, and there are pins which are already embedded in a silicone ring. The moment you apply this, it cuts the foreskin and it applies the pins. So there is no need for suturing in this technique, and it's a 5 minutes technique. It's very simple. We just have to apply some anesthetic cream on the penis, and most commonly this is done under local anesthesia. We just give local anesthesia to the tip of the penis and we do this procedure. In 5 minutes you are out of operation theatre. After 15-20 minutes you can actually walk back. So now there is no need for rest in this stapler circumcision, but what only thing you have to be careful about the sensitivity part. As we said, you have to regularly apply the desensitizing cream for first couple of days after this stapler circumcision, and these staples will fall away after 10 to 14 days, and we don't have to remove them. But rarely, 1 in 50 patients, we might have to remove those pins, because they get struck with the skin. That is a rare phenomenon. But you get very good, excellent cosmetic appearance with stapler circumcision, because you don't see a big wound, you see a small line compared to open circumcision. So open circumcision, it's a crude method. We cut the foreskin with the scissors, so that always there are too many suture marks, and the cut end is always irregular. So now compared to stapler surgery, the other method what we regularly do is either laser surgery or cosmetic circumcision. So the difference between these two is, in laser circumcision, for cutting we use, instead of using a knife, we use a laser. So advantage with laser is, you see, basically whether you cut or use a laser, it is after giving anesthesia only. So after anesthesia, this is actually useful for the surgeon. What happens is, when we cut the foreskin, the small bleeders which keeps leaking blood, generally with laser circumcision that is very less, and the cut is always in a straight line. And even with cosmetic circumcision, it's like a plastic surgery. First we design where we plan where to cut, and after cutting we suture them with very fine suture material. Again, it takes around 8 to 10 days for these sutures to fall off. We don't have to remove those sutures. So now, which one you have to choose, whether laser cosmetic circumcision or stapler circumcision? So if you only difference between these two procedures is the timing. Cosmetic circumcision will take around 40-45 minutes. Stapler circumcision will take only 5 minutes. Cosmetic appearance after the surgery, after a couple of days, is similar for both. You don't see stitch marks in both of them. But what happens is, when there is infection, it's better to do cosmetic circumcision. If there is no infection, then stapler circumcision is better. But apart from these two things, there is a new technique. We call it as prepugioplasty with frenuloplasty. Here we don't even cut the foreskin. We only repair, or actually loosen the, it's a technique to loosen the foreskin. So now here, if you want your foreskin to be retained, then prepugioplasty plus frenuloplasty is ideal way to have a natural look. In other two procedures, you may not have a natural look. People will know. The moment you see, you know that you have been circumcised. So now, pain wise, prepugioplasty is much simple, painless. You don't need dressing. But if you go with stapler circumcision or cosmetic circumcision, you may need dressing for a couple of days, and initially some amount of swelling, edema may be there, but with prepugioplasty may not have any edema with this. So viewers, if you have any doubts regarding these procedures, please post it in comment section. We'll try to answer them. Thank you.